All righty. So, Oscar, congratulations.
Thank you.
So usually what we do is we just give about 15, 20 minutes or so for you to just have the floor and let us know your journey. If there's any questions at the end, let the group, the crowd, the audience, the Beastslayers ask, and then because of you passing, um, that gives a free pro bono high yield
Yeah.
session that you joined before because somebody else passed. So you're passing the baton to someone else soon. So here you go. The floor is yours, Mr. Oscar.
Well,
Let us know your journey and how many times you took it if you want to, whatever you want to share, it's up to you. And how'd you get the pass in and got a good score? And I saw that, man. And yeah, here,
yeah,
floor is yours.
it's a very long journey. I came from APA academic institution. They are hard in neuroscience there. I teach neuroscience there, and I first tried to the writing day. I believe 430 or something like that because I went there with this mindset that I can be able to pass it, but I I didn't, and I feel very upset because most of the question they were wording in the way that I don't get it. In that moment, I start realizing I don't know a lot of. So I am Hispanic, and English is my second language, and I believe we constantly assume we know words that we don't know. For example, the last week I was talking with my ex supervisor. And I asked him, Oye, you know what is dysphoric means? Dysphoric? Because we use the word, but literally we don't know what the word means. I don't know if any of you know what that means, but dysphoric means a difference in the mood state. Can be high
Yeah.
or low. And that issue, that is a good example of so many words we don't know. And when we go to the test, they ask something and we think we know and we choose the wrong answer. In Puerto Rico, we said this test is a lot of uh, question coge de bobo, like a dumbass question, like a for trick you up. And I believe the thing that helped me in the test is learning the language, the wording they use, because so many times doesn't make sense. For example, one day I get a question about a supervisor. What is at least his minimum duty or something like that? Was wording in a way that throws me off because I don't know what they want, what they mean. The most important thing or the least important thing. And the question was very very tough. I saw another question about, and a lot of people get that question. It's about group assessment for ADHD. That doesn't exist, but it's not about that.
Exactly.
When they said group assessment, it's a bundle. It's a bundle of testings. It's not a group of children, and that is something that throws me off. I use AI a lot of times, and I start going back and forth with the AI, try to maybe.
What? You used AI and passed the E
Yeah, I used to polish my answering. For example, I gave the chat GPT some subjects, and I tell the chat GPT generate some questions in different ways in order to me to learn how to answer the question in different scenarios. Because I believe that is a problem because they have the same question in different ways, and that changed the answer.
Yep.
And I don't know what more to say.
No, you're good.
Like,
So, let me prompt you a couple questions here. So, um, the week leading, and then I'll open the floor for the next 10 minutes or so. So, the week leading to your test dates, where were you at mentally? Was the anxiety through the roof? Did you feel like a weird calmness? Was it a combination of both? Like, were you more anxious or calm the week of? And what did you do to help out with
yeah,
whatever state you were
the
in?
the last time I went so confident,
Hmm.
calm. I was sure I gonna pass it, and I failed.
Hmm.
When I passed it, I was a little bit nervous, more than the before the time before,
Yeah.
and I took time to read the questions over and over. I believe that helps me up. For example, because it's too many questions, and I get desperate, like anxious to get out from that place.
Hmm.
And this time, when I feel that thing, I take a break,
Hmm.
and
Hmm.
I go out. I drink something, and I return because I
Hmm.
believe that is shooting myself in the leg because I start rushing out the questions because I want to go out from that place, and that makes me make a lot of sloppy mistakes.
Sure. Sure. Yeah. All
And
right,
I
Flora.
met you. I wish to meet you before
Hmm.
because I believe this system is super good because my wife one day told me I was studying with people that doesn't challenge me,
Hmm.
and I believe that she was she was right in that moment because she told me that like a tennis metaphor. She played tennis, and she told me that when you play tennis, you need to play with people better than you
Hmm.
in order you to get better. Because if you start playing with people that they don't know too much, you are not improving.
Hmm.
And that I meant like this system like Slayers is challenge me when I see the question I start failing question. You shit, I don't know
Hmm.
nothing.
Yeah, it's all about inoculation. So the address to send the check to is 498.
Yeah,
I appreciate that. But yeah, like I said before, I'm really big on inoculating our minds before we take the test because we go in saying, "Oh, well, I've taken hard practice questions throughout the past 4 or 5 months." You know what I mean? So it doesn't come as a like a gobsmacked as the first time I took the test. Is that was the one word that best described how I felt after taking the test the first time was
and I
gobsmacked.
use PrepJet, I use ATV tabs, I use the site prep, but I believe this system is even better is by kilometers better than them.
So you're asking for double what I already wrote you in the check, right? So
Hmm.
I
Yeah.
appreciate that, man. Very, very much so. All right. So floor is open for questions. Whoever wants to ask first, chime in or raise your hand or whatever you want to do. It's up to y'all. I appreciate that, Oscar. That was not a paid advertisement, by the way, because this is recording and being public. That was not a paid advertisement. So thank you, man. I appreciate it. All right, who wants to go in?
Juliana, when did you test?
In a month.
In a month? I believe you have the content. I believe it's the
I agree.
wording. You need to
Yeah,
learn the wording, the way they ask.
Yeah, the
Because
wording
I
they
used to
use.
study with you and I noticed you know a lot of content.
she does. Yep. Agreed.
Yeah,
Agreed.
we need to be careful when we choose answers because these questions they use a strange language sometimes and they for example I always remember the question about neuroleptics.
Mhm.
Hmm.
In that
Hmm.
moment I didn't know what is neuroleptic. Yo, what is neuroleptic? What is that? I
Hmm.
never hear that.
Yeah.
Yeah, you really have to have stuff cemented. The
Oh
last
yeah.
took, I mean, there was stuff on there when I came out, I was like, oh my God, I knew that. How did I stumble?
Yes.
But you can
How
remember
did it
because
not come
neuroleptic
in the moment?
malignant syndrome is part of the antipsychotics,
Yep.
and now you have two things
Yep.
together.
Since you called me out, I guess I'll ask because I've spoken to Oscar before, but for those that may have not, did you have any accommodations?
Yeah.
Do you mind sharing what those were?
They gave me extra time.
Did you have
I
time and a
believe
half or double
one
time?
point five.
Time and a half.
Oh,
Okay.
yeah.
Okay. Hmm.
This
They
time,
gave me a separate room.
Hmm.
The room for me is not no doesn't make. I believe the timing is the thing,
Hmm.
yeah.
because when I went the first time, I barely have time to say I run out of time.
Hmm. Yep. Yep.
Then Scott told me, no, you need to ask for accommodation because you don't speak English. It's your second language, and you takes too much time to read the question. And I have ADHD too,
Hmm.
Mhm.
so,
Yep.
Part.
and
Yeah.
that plays against me because I get like frustrated to be there. I start choosing answer without no without realizing.
Yep. Absolutely. 100%. All right. Got enough time. I got time for another question or two. Anyone else? I got some
Ah,
people who.
Daniela, todavía.
Hey, hey, congratulations. I don't think
Thank
I
you,
got
thank
to
you.
tell you since you passed, other than on Facebook. How you
Nice.
feel?
Fine. I still waiting for the board to give me my license. I am on vacations. I still
Mm.
on vacations.
Oh,
Rush
nice.
them. The way they rush you, rush them.
Yeah.
Yeah.
Yes.
Yes.
Oh, rush
Uh,
them. Yeah, you
Yeah.
apply
got
that
I
too
pressure,
much
Oscar.
time. It's
Yes,
been enough
indeed.
time.
Yep, yep, yep. Cool. Sounds good. Well, within 30 seconds or less, Oscar, give the floor, the Beast Slayer, some closing encouragement because the hope is every single person on the screen right now will pass the EPPP. So
yeah,
how can you
it's I
help with
believe
that?
the thing that makes gave me confidence is the thing is doable.
Hmm.
It's not impossible.
Hmm.
So I know stupid people passing the thing. So
All
people that
right.
they are not smart and they pass the test.
Tommy Pass? Oh, he's stupid. I've got a
And
chance.
I realize it's the English thing.
Gotcha.
Because
Yeah.
I was doing my personal research, and I noticed a lot of Caucasian people,
Mm,
they took the test and they passed it.
mm,
And the Hispanic, we cannot pass the test. We need
mm,
to take the test over and over and over. It's
mm.
because the language.
Good old intercept bias,
In
right?
Puerto Rico, I failed the Puerto Rico test once. And I
Mm,
feel the same thing because in Puerto Rico we have a Spanish version of the test,
okay.
and it's a translation.
Gotcha.
And the translation is very bad.
Ah, okay. Gotcha.
It's very bad. It's the same effect when you read when you take the triple P and you are English as a second language speaker. The same thing.
Mm, mm,
Mhm.
yeah.
I feel the same way, Oscar. I'm French first language,
Yeah, I
and
was thinking
although
of you.
I did my undergrad as well as my university in English, so the context vocabulary, the subject specific vocabulary I know in English. However, my everyday spoken language is French. So similarly to you, there are so many terms that I'm just like, what on earth does that mean? Today, for the first time, I made a connection with contingency meaning the same thing as dependent,
Mm,
which I was like,
mhm.
ah, it made so much sense. But it's
Yeah.
true that the language
Mm-hmm.
barrier is a tough hurdle.
Mhm.
You know the difference between hard science and soft science? No, you never
No.
hear chemistry is a hard science
Oh.
because you can see the elements. You can put the thing on, but psychology is soft science.
Mm,
Not always is we have the truth. So we you can have a like a equifinality and multifinality. You can have a lot of stuff and finish in the same thing, or different things and finish. Is
Mm-hmm.
psychology is a is soft science.
Right. It's all theory.
Yeah.
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 So some questions needs content, but too many of those questions you need like a malice,
Mm,
like a critical thinking.
Mhm.
sure.
But
Yeah.
you need to learn, so you need to understand the language to accurate select the right choice.
Hmm.
I
I
was
have a
Absolutely.
doing like a
question.
list. My supervisor one day told me make a list of these strange words. When you read it, put apart this word. You truly know what this word means because it's you're gonna be surprised how many of those words we don't even know.
Mm,
The other day I see some people in Puerto Rico doing a speech about um, anedonia
hmm.
because a lot of people doesn't know what anedonia means.
Mm,
For us, it's basic, but
mm,
it's a good example of the words.
mm,
Or
Hmm.
alexithymia, they put you alexithymia. You shit, I know it's anedonia, but alexithymia I forgot.
mm. Yeah. Pro, you got a question?
I sure do. Hey, Oscar, buddy.
I
Proud of you.
That was a warm greeting.
Of
Hey, Oscar,
course,
buddy. That was
buddy.
nice.
Gosh, I saw him in the struggle, so
Yeah.
much respect to him.
Yeah.
I have a question. What I've been hearing, because I've spoken to a lot of people that have recently taken this test, and they're saying that they're feeling that the questions, the domains are being weighted similarly versus the big six and the rest being weighted smaller. What did you feel about the test?
I took the test 7 times, and I never repeat a test. One day Scott told me each state have specific amount of tests. It's something you buy as a government, and the board they buy some tests. And he told me he thinks that Texas have 6 versions.
Oh, wow.
Maybe the last is too much time, and I don't remember a lot of questions. But for example, this the neuroleptic question, I never get the question again in the 7 times. The
Would you say that it's more evenly, or it is mostly the big
no,
six?
they have a test. It's very hard on research,
Okay,
and
Interesting.
not all the questions have the same weight.
right.
Mm,
One day I took the test, for example, and I have the paper sheet there. I took it today. Because I was thinking, so it's some stuff I don't really understand. But this test was, I took the test 7 months of each other. Let me see, where is the score?
465, I thought.
But one is 7 months after, and I get exactly the same score. And I was very like a superstitious there. Maybe these people have my name there and they don't want to.
No.
The funny part is like when I passed it, I took it in Houston. I don't took
Okay.
it here. So
Okay.
I don't know. My mind goes to everywhere. So I was thinking maybe we are near the border. They don't want Hispanic psychologists here or something. I don't know.
Right. But I've heard that each test becomes increasingly harder. So if you do get the 465, well, the next test is even harder. So you, in a sense, you're getting the same score, but you're getting harder content.
One day I get 499. And I was waiting for them to give me a break. Maybe
You said
What?
it's only 1 point.
It's
Hell no.
Oh my
Hell no. I
goodness.
don't
That's
believe that.
horrible. Oh my goodness.
Let me
Oh,
see. Don't know if I have it.
Crazy.
499.
Bro.
gosh. I'd rather be far away than to be that close.
Yes.
Yeah.
Oh, oh my
My
I would
boy
cry.
gosh.
Oscar, he made it
That's
to the other side with
horrible.
flying colors.
Flying colors.
Oh yeah.
Flying.
Yeah, for sure.
Well, I recently got accommodation approved, so for double
Yeah,
time.
Oh,
take your
nice.
break.
So hopefully
Take
it
your time
helps.
reading the question. Don't answer it quick.
Mhm.
The
Okay.
test, the environment tricks you up because make you I know the answer and you select it. don't feel so confident. Read
Don't
all
do
the
that.
questions. Use the method of Jablon. I believe reading the question, putting
See,
the question in your
Mm, you froze.
words, thinking that is not because that. That is not because that. And then you're gonna find the right answer.
did you see like that 3-question ones on there?
Yeah,
Okay.
Mhm.
Okay.
Yeah.
but 3 question is all ¿cómo es? It's more easier.
Yeah, you got an 8% bump right there. That's a higher
That's right.
percentage to getting the answer right. Yeah. Well,
That because
Oscar,
that is the problem. They put you 4 answers, and you have two
yeah.
almost correct ones. You
Mm.
need to know which one is incorrect.
Mm, mm,
Okay.
yeah, yeah. Oscar, thanks, man. We really
Yeah, no,
appreciate
thanks to
you.
you. And I wish to know you before, and Gasaway, Dr. Gasaway.
Hmm.
She helped me a lot too.
Hmm. Oh, yeah.
You're the
She's
man,
awesome.
Oscar.
Yes,
Way to go,
indeed.
Thank
buddy.
you.
Thank you,
To
Oscar.
our
Have a good
psyche.
night, my man.
Bye.
Beast Slade.
Thank
Good
you.
job.
I am waiting for my shirt. It
It's
was something with what's
so I have the shirts are make believe right now, but I am so serious about like I have literally I think about Beastslayers all the time actually, as far as how to continue to grow. And yeah, giving shirts is certainly one of the top on my list to do. So
Yeah,
It'd
I
be
wish
like the
you
white coat, but
yes,
Yeah.
Beast
indeed.
Slayer shirt.
There you go. Very nice. Awesome. Oscar, thanks, man. Have a good night, my friend.
being likewise.
All right.
Bye,
Bye.
Oscar.
Bye.
Bye-bye, Oscar.
Enjoy the freedom.
Yes, indeed. Very much
Okay.
so. Yes. All right. Um, all right. So, through the next half hour that um, we have a thank you, Oscar, uh, high yield session here.
Whoop,
So,
whoop.
yeah. So, I grabbed four, um, four concepts from previous areas that I've taught, and they're just random. I usually do random stuff when someone passes, and so I'm going to bring that up now as soon as I learn how to delete all these tabs. Every day, I just feel like I clear most of my tabs at the beginning of the day, and then by the end of the night and end of the day, it's filled again. So that unfortunately affects my computer speed. So as soon as it comes up, here we go. Um, Laura, are you new to us?
Yes.
Oh,
I don't know
welcome.
if Chantel, um, I've done different things.
Oh my gosh, Lord.
I know. I should have probably done that same thing too. I came and I was like, let me see what I can scavenge in
Sorry, y'all.
leftovers real quick till I can get to dinner.
I promise,
Yeah.
Laura, it wasn't because I wasn't interested in what you said.
Dang, Dr.
My
Chris.
my computer, my Zoom, I'm telling you, Zoom does not like my computer. I was interested. You said something about Chantel,
Yes.
and I was like, "Oh, interesting," because she's amazing. And so then I was like, it just cut off. I'm like, "What?" So yeah, please proceed.
Yeah, no, I just said that Chantel and I work at the same place,
Oh,
and
nice.
we've been studying together. And she's taken the test a few times, and I'm right behind her. And I failed my first, and no, and we've gone through all materials that PrepJet and other things, and I don't know what else to do. So she suggested to come to your sessions because she really enjoyed them,
Oh,
and
nice.
she feels that um, you really helped her. So yeah,
Oh,
I signed up for a few this week and next week, and I'm excited to learn.
yay. Well, thank you. I appreciate that. All righty. Speaking of sessions, here's a little sneak peek of what we do over here at Beastslayers. All right. Um, so there we go. Hopefully it just doesn't doesn't go away. Um, yeah, I don't know why my daggone thing is just super slow right now. All right, before actually, let me not share this right now. Usually what I do is I start off with a few questions just to see where everyone is. So I would do that um as soon as my my computer just stops acting fool. So, do you have a date yet, Laura?
Yes, October 26th.
Okay, got a couple months. Yeah, no problem.
Mhm.
All right. So here is the first question. So what I do is I put a question in the chat, Laura. Everybody else has been here before, right? Oh, Pastor Catherine and L. Smith. Um, New as well. Welcome. Appreciate y'all coming. Um, how'd you know about how'd you learn about Beast Slayers? And um what do you what do you who are you? Like I'm interested. I like to know people.
Yeah, can you hear me okay?
I can.
Okay, great. Hello everyone. My name is Lorelai.
Hi.
Sorry, my video is not working at the moment, but I will join with video the next time. So
Thank you.
just to be a quick rundown, I graduated in 2018. I took the test 7 times, and there is a way to pass this test. I know it. I hear great things about you as well,
Oh,
Dr. Chris. And I've seen your videos on Hack the E-Triple-P. I have done and purchased every possible program, and it's been very expensive. And I my test is
yes.
September 23rd. I
Okay.
don't know if I feel good about, I don't feel confident at this
Hmm.
point. I
Hmm.
don't want to keep rescheduling it. So just
Sure.
wanted to keep it short because I know you have about 30 minutes left on this. So yep, I just wanted to check it out.
Thank you. I appreciate you very, very much. I value people's time. So you made the willful choice to spend it here. So that means a lot to me. So I appreciate it.
Yeah.
Yep. Pastor Catherine.
Hi everyone, I'm Catherine. I have taken the E-Triple-P more times than I care to acknowledge. It is, I mean, English is my first language, but you would never know that when I sit down to take it. I'm like, what
Mm,
does this mean?
mm,
So it's just taking me too long to get through the questions to answer it. So I was really resonating with the person who just passed. So
yeah, for
I
sure.
learned about this through a colleague and just looking for, I guess, different ways to, I guess, refurnish my test taking strategies and
Hmm.
get motivated. Yeah.
Sweet. All righty. So what we'll do is if you look at the chat, you'll see a question. If everybody can DM me the answer. And so what you do is you click on new chat and just click my name and give me the answer to that. So the question is, a corporate consultant evaluates workplace dynamics and notes that female executives are routinely interrupted during meetings, while their male peers are praised for repeating the exact same points. This subtle dynamic reflects A, micro insult, B, micro assault, C, institutional overt discrimination, or D, micro invalidation. Got a full house today, so it's okay if you don't necessarily know it. Uh, just let me know what you think. Almost halfway through. Got about like 6 more. There we go. Christmas lights are starting to come up. A few more. It's
Wait, how am I supposed to send this again?
click on everyone, click on new chat. You see where it says everyone. Next to it says new chat. Just click on that and click on my name. Cool. We'll, we will move on. Yep. Okay. Let's see. Um, changing an answer to A, changing an answer to A, D, wait, um, yes, D, C, C, and B. Answer is A and D. Answer is A. All right. Now
Okay,
let's,
I got it wrong.
it's okay.
Okay, so where is it where because I couldn't see the new chat thing. That's why I
So,
answered it like that.
so you see, you answered it to me privately.
Oh, okay, it's
Yeah.
all good.
Mhm.
Thank you.
Yeah, no problem. Um, okay. All right, so that's one of the 4 things that we're going to talk about real quick. All right, so the topics today are priming effects, Kluver-Bucy syndrome, the red dot test when it comes to theory of mind, and micro insults. I love just randomly choosing topics. It's always super fun. So, because all of these topics are on the EAAA, and these are 4 of many. So, and again, this is just a fun taste of what we do. Usually, what I do is domain specific, and when we have these passing tests, I just throw out concepts to see where y'all at and what y'all know. So, all right, so let's start off with priming effect. So, when it comes to priming effect, it's an implicit memory phenomenon in which exposure to a given stimulus, which is the prime, subconsciously influences the processing speed, perpetual accuracy, as well as the behavioral response to a subsequent stimulus, which is the target. All right. prime the target. All right. So basically, if the initial stimulus is nurse, the target responds, which creates a faster lexical recognition of doctor versus bread, right? Because of the similarity. All right. So when it comes to core mechanisms of the priming effect, you want to think of some semantic priming. And again, that's the neural activation spreads through semantic networks. All right. So processing nurse pre-activates nodes for doctor, speeding recognition. All right. So when it comes to repetition priming, that's repeated exposure to an exact stimulus enhances subsequent perceptual processing efficiency. All right, perceptual versus conceptual priming. Perceptual priming is relying on structural form like visual shape, and conceptual priming relies on semantic meaning and associative networks. And then you have affective priming, which anytime you think of affect, think of emotion. All right, so it's exposure to emotionally balanced stimuli influences speed and valence ratings of subsequent targets. And it retains intact in patients with amnesia, such as an example with Korsakoff syndrome, despite severe deficits in explicit episodic memory. All right. So that's the first concept. The next one is Kluver-Bucy syndrome, and I'll attach these slides in the chat for everybody to download. So um, yeah, yep, Melissa. All right, Kluver-Bucy. This results from bilateral deconstruction of surgical excision of the anterior temporal lobes, specifically involving the amygdaloid complex and adjacent limbic structures. So let's talk about some core symptoms real quick. You have visual agnosia or psychic blindness. You'll see that concept as well. You'll see that term, psychic blindness, and that's an inability to recognize objects visually despite intact primary visual acuity. All right. Hyperorality and dietary changes. So you'll have a compulsive drive to examine all objects orally, also coupled with altered eating habits like consuming non-edible items or drastic dietary shifts. Docility and loss of fear response when it comes to Kluver-Bucy syndrome as well. So you'll have a profound flattened affect, absence of normal fear or defense anger, and a lack of avoidance to dangerous stimuli. Also hypersexuality and hypermetamorphosis. So you'll have a compulsive impulse to notice and react to every visual stimulus in the environment. All right. When you think of Kluver-Bucy, think of amygdala plus oral/sexual indiscrimination plus loss of fear. All right. Next, good old red dot test. Theory of mind. All right. Gordon Gallup Jr. So when it comes to the red dot test, think of a red dot is applied to forehead unobserved. Subject looks into a mirror surface. Touches mirror, no self-awareness. Touches forehead, then they pass the mind and self-recognition test. All right. So this is really big when it comes to developmental milestones. Between 18 to 24 months of age is when they typically should pass that test, the red dot test. All right. So about a year and a half to 2 years. So then you there could be some intellectual defects if you're 30 months old, for instance, and you're still touching the mirror when there's a red dot on your forehead. All right. So when you're 30 months, the expectation is that you'll touch your forehead. All right. All right. And those also species passing MSR2, including these. So when it comes to theory of mind, self-awareness precedes the capacity to infer mental states, beliefs, desires, and intentions in others. Okay. And then finally, we have micro insults. There are types of micro insults. So there's specific subtype of microaggressions, and that's of course that's the umbrella is microaggressions. All right. So they're defined as subtle communications, verbal and nonverbal, that convey rudeness, insensitivity, or demeaning messages regarding a person's racial, ethnic, or marginalized identity. So you'll look at, from a structural standpoint, you'll have from an unconscious and unintentional nature. So unlike micro assaults, which are more blatant, micro insults are usually outside the conscious awareness of the perpetrator. All right. So description of intelligence. So you'll assign a level of intelligence to a person of color based on their race. Right. So like you're so articulate, for being African American, for instance, right? It's like, well, wait a minute, why do we have to have a qualifier? You know what I mean? Why not just be so articulate? Um, so when you're thinking of second class citizenship, so you're treating a marginalized individual as inferior or serving a subordinate status. Also, pathologizing cultural values. So, viewing non-dominant cultural communication styles, expressions, or behaviors as abnormal or dysfunctional. And again, it's in contract with microinvalidations, which is another form of microaggression. Microinvalidations exclude, negate, or nullify psychological thoughts, feelings, or experiential reality, right? So you'll say more of like, I don't see color. And I don't see color is also a contact stage as well. Um, who's anybody remember what cross-cultural model that's a part of?
The racial culture identity model?
RCID. Anybody agree with that?
I was going to say Helms.
Okay. Helms.
Yeah, I'll go with Helms too.
Oh, the
Helms.
white, what is it? The white racial identity model?
Yep, it's Helms. Yep. Yep. Contact is Helms. Because Helms, always think of like Helms is a black lady um, teaching about um, um, helping majorities understand minorities, right? So the contact phase is the I don't see color part of Helms. All righty. All righty. Well, that is the four. And so as Juliana loves that I do. It even comes with the passing, Juliana. This one's for you. There you go. Right. She loves these reference guides, and I love putting them together for you. All right. So these are the four. These are the analysis. These are the clinical vignettes and the answers. All right. All right. So next is questions for the next 7 or 8 minutes. All right, question number one. This is what we do. This is what we'll do. Um, I will call a person's name. No pressure. All right. And again, you can I'll let you
Phone a friend. We can phone a
Yes.
friend.
Yes, you can phone a friend. You can go 50-50. Okay. Uh, what's the other one? Ask the audience. Phone a friend or 50-50. All right. Cool. All right. Let's go. Let's go. Let's go, Pearl. I'll let you read it. And if you know it, go for it. I want to, because we only got about 7 or 8 minutes, 7 or 8 minutes, I want to uh, get as many questions as we can. So let's spend probably a minute a question. You want to read it out loud?
Sure. A researcher presents subjects with a list of words including ocean, beach, and sand. Later, subjects perform a word stem completion task and complete it significantly faster than control subjects who are not exposed to the initial list. This finding is best accounted for by A, spreading activation within somatic priming, B, explicit episodic retrieval, C, retroactive interference, or D, state-dependent learning. So I'm going to take a lifeline. Okay. Let's see. Anybody want to raise their hand for this one? For a phone a friend. Okay, let's go, Mel.
So spreading activation is the same as a spider web where you kind of have an anchor, which are like
Okay.
specific words, and then you say the one word and it goes into similar words.
Like word association. Okay.
Right. It's a good
And it's
hint.
not, it's, so then you're saying it's A.
Oh, you're
Because
saying it's A.
it's not episodic retrieval. It's not,
That's correct.
okay. I was
Yep,
like, it's
you're
not
correct.
interference
Hmm.
and it's not state dependent learning. That's for sure.
Yep.
So yeah, somatic. Okay.
So the
Thank you, Mel.
web, so the web, like
You're the
Melissa
bomb.
just said, good job. All right, who are you passing the baton to, Pearl?
Laura, because she's in my
Uh,
area.
nice. All right.
Let's go, girl.
Yeah. All right, here you go. You can read it out loud for
Okay, a
me.
60-year-old patient with severe anterograde amnesia due to chronic alcohol use disorder, Korsakoff syndrome, is repeatedly tested on the Tower of Hanoi puzzle
Hmm.
over several days. His completion time drops dramatically, yet he denies ever having seen or played the puzzle before. This clinical observation demonstrates intact explicit episodic memory despite impaired implicit memory, intact procedural memory and implicit priming despite impaired episodic memory, complete preservation of working memory buffers, or retrograde amnesia with preserved semantic encoding. Mm, I'm thinking it's so what are the options here?
You can do 50-50. You can, I'll reset each of them once they're
Okay.
all spent. All right. So the phone a friend was used already.
Okay.
So you get to either ask the audience or 50-50.
Okay, let's ask the audience.
All right. So I'll have a few people DM me the answer, but I'll have to do it quick though. So I'll get the first three or so that I get because of time constraints. All right. One, two, and all right. We only got two. Come on, need one more. There we go. All right. C, C, and B.
Okay. Mm. Okay, position working numbers. I'll go with C.
C. Righty, the answer is B.
B. Procedural memory.
Yep, yep. All right. Who are you passing the baton to?
Daniela.
Daniela. Right.
Hey, hey.
Yes,
All
indeed.
right.
Here we go.
All right. Which type of priming is characterized by enhanced target processing due to structural or visual physical similarity between the prime and the targets, independent of semantic meaning? Ooh, it's a mouthful. Which type? Oh, A, conceptual priming, B, affective priming, C, perceptual priming, or D, priming. Which type of priming enhancing target? I mean, it's talking about visual. So it makes me want to think perceptual, but I have, as I haven't gone over this area in a while. Am I froze?
Yeah, I was gonna say, is it me
Oh,
or is it Daniela's frozen? Daniela's frozen.
I think
Okay.
so.
Okay. Oh, okay.
Yeah, I think so.
hold on
Okay.
now.
Oh, no, I see you. I see you on the other one. Just fine.
Okay, sorry guys.
No problem.
All right, so my answer I thought was going to be, make this wider. Can someone tell me the answer choices again? Because my screen is too small.
Sure, no problem. A, conceptual priming, B, affective priming, C, perceptual priming, or D, semantic priming.
Ah, okay, okay. So I thought it was perceptual. But I would love some help to confirm or
So
to
the
see what you guys think.
so the last one left is 50-50. So
Okay.
you can remove B and you can remove D.
Okay, I'm gonna go with C for 500.
C. So I love it because like I can't be sued for copyright infringement because we just added Millionaire and Jeopardy in one big bunch. So
Let's go.
Let's go.
very nice. You are correct. Good job. Wonderful, wonderful. All right, so I have time for one more. So who you
All
passing it
right,
to?
my girl Juju.
All right, Juliana, let's do it. Here you go.
Uh-oh. A patient presents with bilateral temporal lobe destruction secondary to an opportunistic viral infection. The patient displays profound docility, hyperorality, visual agnosia, and hypersexuality. Which subcortical structure destruction is primarily responsible for the affective and fear processing deficits observed in this syndrome? A. Hippocampus, B. Amygdala, C. Caudate nucleus, or D. Ventral tegmental area. Okay, temporal lobe, opportunistic viral infection, visual agnosia. Um, I'm gonna go with B for Bob for 600.
B for Bob. You would be correct.
Oh,
Good job. Good job. All right. That was fun.
Way to go, Juju.
Yes,
Thank you.
indeed.